Yes, hello guys. Good day, good evening, good morning, good afternoon to each and every one of you listening and viewing my presentation or rather, our discussion about the microscope. This is the microscope with your peripheral blood smear evaluation. This is prepared by Sir Leo, of course, the very participative and active Sir Leo Teofane B5. And yes, so for this discussion, we are going to talk about the microscope's history, who contributed to the making of your microscope to what it is now. And then we are also going to talk about the persons, the people behind it. We also have third one. We are going to talk about its parts, the different functions of each parts of your microscope. And then we are also going to talk about the different types of microscopes. Yeah, there are a lot of microscopes that are available in the laboratory and, of course, in other research fields. And the last one would be viewing of some specimen in the peripheral blood smear evaluation using your different objectives. So basically, we are going to tackle those five, categories or subjects within this discussion. So I hope you are ready to learn. So let's start with our program. Charot. Anyway, so basically, the microscope, it is a device in which it is used to magnify an object to a point where it can be seen with a human eye. Of course, that's the main objective of your microscope. It is, to magnify an object because basically, or we always use the microscope for things or for organisms that we cannot see just by using our eyes. And then we also have here the total magnification observed, okay, is the product. So you are going to multiply this one, okay, of the magnification of the two lenses, namely your oculars and then your objective lenses. So, yeah, we'll delve into that deeper, when we are going to tackle about the different parts of your microscope. So, basically, that's just a run through of your microscope. Um, Wait, let me just use your highlighter here. Okay, magnify an object and then the total magnification. Okay, just take note. The total magnification is the product, okay, of your two lenses, mainly your oculars and then your objective lenses. Okay, let's proceed. So, for now, guys, I'm very sorry for the like medyo long, awkward long pauses because I was drinking my coffee a little while ago, and you know me, or if you don't know me, basically sa mga previous or the previous lectures we had, I was having like heartburns and then just acid reflux. So, if ever I am going to have those like medyo awkward pauses, please do forgive me. That is the result of excessive intake of coffee. Anyway, let's proceed. Okay, commercial break number one. Anyway, let's talk about the history of your microscope. So we have here during your 14th century, okay, the art of grinding lenses is developed in where? Of course, in Italy. And spectacles are made to improve eyesight. Now, in the 1590s, Dutch lens grinders' hands, okay, so this was actually like, what do you call this? An occupation dated way back lens grinders. So we have Hans and Zacharias Janssen. make the first microscope by placing two lenses in a tube. Okay, just two lens, and then we have like a tube. So that's the first microscope that was made. Okay, take note. First microscope. Okay, now during in 1670, Robert Hooke, okay, I think you all his work were a description of a cork and its ability to float in water. So next we have here during your 1675. So, do you know how to pronounce this word? You know his name? Basically, yes, long pauses there. Anyway, long pause. So when I was still studying, I I actually pronounced this incorrectly. I mispronounced this as Leeuwenhoek. Like what? Anton van Leeuwenhoek. So basically, the correct way to pronounce his name is Anton van Leeuwenhoek, 'di ba? Very, very koan. Let me just change that. So this is pronounced as lay. Okay, so the stress is on the first syllable. Leeuwenhoek. Yes, okay, Leeuwenhoek. Anyway, so we have here Anton van Leeuwenhoek. Please remember, okay, father of microscopy. Who is the father of microscopy, guys? Who is it? Kinsa? Okay, very good. O, di ba? May pag-ganun si ma'am. Anton van Leeuwenhoek. Please remember, father of microscopy. So he used a simple microscope with only one lens to look at blood, insects, and many other objects. So he basically was the first to describe cells and bacteria seen through his very small microscopes with, for his time, extremely good lenses. So later, I am going to show you a picture of his simple microscope. Actually, it's really small, and then but it did the job right. It he was able to, what do you call this, he was able to describe your red blood cells, your different types of cells, and your bacteria with it. That the muna siya ang basis that served as our basis for how we describe these cells, today. So that's because of your father of microscopy, kinsa to? Yes, very good. Anton van Leeuwenhoek, 'di ba? Anyway, okay, so let's proceed. We have during your 18th century, guys. Okay, so I want you to take note, there was an important discovery. Okay, it was that lenses combining two types of glass could reduce the chromatic effect with its disturbing halos resulting from differences in refraction of light. Okay, so when you combine lenses, two types, of glass to make a lens, it actually reduces the chromatic effect. Okay. Okay, sorry for the pause, guys. I was having a mental breakdown. Charot, joke. Unsa tawag ani? Yeah, problem with spherical aberration by showing that several weak lenses used together at certain distances gave good magnification. Okay, so a little bit of hugot right here, even though you are broken to pieces. Charot, even though you consider yourself as weak, when you clump together, charot, when you clump, when you join forces, and like help each other out, as what I always say to you guys, you have to help your co-workers, charot, your classmates. When you work together, you can get good grades or good magnification without blurring the image, o, di ba? Anyway, father of microscopy, guys, who is it? One, two, three. Okay, very good. Anton van Leeuwenhoek. Next, okay, so this is your Antoine, charot, Anton van Leeuwenhoek, and this was his first microscope na iyang gigamit last time, di ba? Very small. This is actually like mga I think bigger than your thumb actually. So yeah, it's just a small microscope with a single lens, but it did the job right. Okay, next. Yeah, that's it for our history. Next, we are going to talk about the second part or the third part of this discussion. We have your parts of the microscope, okay? So, guys, I want you to take note that all types of microscopes, okay, contain, let me just use my pen. Guys, this will be my board notes, but it's so hard to write. So we have your lens system. Okay. Lens system. Oh my gosh. We have your illuminating system. Guys, I want you to take note. And the third one, we have here your body. The body. Charot. If you don't understand that reference, we can't be friends. Charot. Anyway, we have here your all types of microscopes, guys, contain a lens system. Basically, they contain a lens system, an illuminating system, and then a body, which consists of your base, your body tube, and then your nose piece. So basically, yeah, that's the main components of your microscope. Lens system, illuminating system, and then we have your body. Now, I want you to take note, guys. Let me just erase this. The primary components of your lens system, okay, are your oculars, and then we have your objective, okay, your objective lenses, and then we have your coarse, and then we have your fine adjustment. So these are the components of your lens system. Now, let me just change a color. Let's choose green. So this will be your illuminating system. Now, for your illuminating system, it contains your light source, and then we also have your condenser, and um, yeah, where is the condenser? Oh, yeah, where? Okay, your light source. We also have a condenser and your iris diaphragm. So basically, in a picture, guys, there's no condenser. So what's missing is your condenser, and then, but basically, your condenser is somewhere here. Yes, hello, guys. I am back again. A little bit of heartburn there. But basically, guys, okay, your condenser is somewhere here. Here. Okay, so that's it for this slide. So we are going to delve in deeper with your parts of the microscope in a second. Okay. So we have here your microscopes can either be a monocular or your binoculars. Of course, from the name itself, monocular has only one piece, eyepiece, while binoculars have two. Now, take note, binoculars, this is usually used, to allow viewing of both eyes, of course, and it results to lesser eye strain actually. Yes, okay, sorry about that. So it results to your less eye strain, your binoculars. And then first part of your microscope, we have your eyepiece or your oculars, okay? Now, basically, guys, your oculars are located at the top of your body tube, okay? So, um, these what do you call this? It is usually equipped with your 10x lenses, and then the lenses magnify the intermediate image formed by the objective lens in the optical tube. And also, one thing about your oculars is that they also limit your area of visibility. Okay, so take note 10x, I already told you a while ago, kabahin atong microscope, the total magnification, di ba? Remember pa? Total magnification is the product. Okay? Good. I hope na remember pa. Father of microscopy? Yes. Okay, very good. Charot. When was the first microscope? What year was it made? Yes, okay, very good. Laban, guys. Anyway, yeah, we also have your next part of the microscope. You have your interpupillary control. So it is used to adjust the lateral separation of your oculars for each individual. So we have here your oculars and then na siya murag something na ana bato. My God, mura siya tawo. Wait, ano yung tas next? So, basically, this na siya diri somewhere here na pwede nimo ni siya, you can actually um, farthen, like mabira nimo siya, mo wider, or manarrower ang kaning distance. Okay, murag layo ra kay ni tinuod kay. So, I'm going to erase that because it's embarrassing. Anyway, now, next, we have your arm or neck. So it provides a structural site of attachment for your revolving nose piece. Okay. And then, guys, I want you to take note for your interpupillary control. It should be properly adjusted. Okay. So the user or the medtech should focus both eyes. Okay. Because what we usually use in the lab are your binoculars. So of course, we should focus both eyes comfortably, and we must see one clear image only. Okay, because as what I have experienced face-to-face classes last year, I think. No, 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 no. Last year, there were like second year students who are now third year students. We were having medical histology, and during that time, there were a few of them actually who still don't know how to focus their microscope, like kanang unsaon nila paglantaw bitaw comfortably. Kay what they do is that they usually view, the binoculars or your microscope using just one eye. So they close the other eye, which is not comfortable actually. So um yes, okay. So sorry about that. So it actually leads to stress, like ergonomic hazard, 'di ba? Putting unnecessary stress to parts of your body. Anyway, okay? Your interpupillary control should be properly adjusted to fit you comfortably. Okay, next one, we have yeah, I want you to take note also that for your arm or your neck, it should please handle it with care, in which the microscope can be carried without damaging its parts. So you have to hold the microscope, when you are from the stock room or when you are moving a microscope, you have to hold with one hand the arm of the microscope, and then your other hand should be at the bottom or below the base to support the weight of the microscope. Okay, now next for yeah, we have here your revolving nose piece. So it holds the objectives and allows for easy rotation from one objective to another. Okay, so we are going to see that later on. And then next one we have your objectives, the main lenses, the most important, um, if not the most, I think the most important part of your microscope. So we have your objectives. Most objectives have 3 to 4 lenses. So we have your scanner 4x, LPO is 10x, we have your HPO 40, and then your oil immersion is 100x. So these objectives, it contains, as what I've said, and the revolving nose piece, which is located just above your mechanical stage. Now, they are adjusted to be near the specimen and perform, the initial magnification of the object on the mechanical stage. So the image, guys, okay, the image that you are looking at, it is then okay, it will then pass to your oculars for further resolution. Now, I want you to take note of this word resolution. So let me just, yeah, my board notes. So resolution, okay, it is the ability of the lens to distinguish two small objects that are at a specific distance, two small objects that are at a specific distance apart. Okay, so please take note. The resolution is your ability of your lens to distinguish two small objects that are at a specific distance apart. Okay, that's it for your objectives. Now for your stage, it supports the prepared microscope slide to be reviewed. Okay, so please highlight that one. Um, to support slide to be reviewed. Okay, go. Let's proceed. Now, most have mechanical stage, which make it much easier to manipulate the object being observed. Now, next we have your mechanical stage knob. Okay, is also available by turning the knob left and right or backward and forward. So this is usually the like this, and then naa siya diri something. Oh my god. Yeah, this one. Stage manipulator knobs. Backward, forward, up, and down. Yes. Okay. Left and right there, guys. Left and right, backward and forward. Now, up and down is for your adjustment knobs. I'm very sorry about that. Please don't get confused. Okay. Now, next, we have your stage clip. Okay, to keep your slide stationary, dili siya mapunta sa lain, just like your crush. Charot! So, whew, laban. Anyway, it is to keep it safe from falling or damage actually, because naamay uban medtex na dangag and basin niya malagpot or what, makalimot sila na gagamit day sila. We have your condenser. Okay, your condenser, as what I've said a little while ago, it focuses, as what I've drawn a little while ago, actually, it focuses or directs the available light. I want you to take note of this, guys, into the objective as it is raised or lowered. Now take note, this is like a what do you call this? A inversely proportional. Lowering your inversely proportional relationship. So lowering the condenser will increase the contrast of your unstained specimen. Now, so what this means is that when you lower your condenser, okay, the light that passes, it will actually increase the contrast of your unstained specimens. This will lead to a better, what do you call this, a better clarification or a better image of your slide being viewed. So this is really helpful, especially for those, what they call the specimens that do not require, or it usually doesn't incorporate stains, because maybe the organism will die, or it will simply, yeah, die when it comes into contact with your dyes. So stains na lang, stains. Okay, so it will die when it comes in contact with your stains. Now, next is your iris diaphragm. Now, this one actually, it regulates the amount of light that strikes the object being viewed. So when you see condenser, it talks about, your objective, while your iris diaphragm, it talks about your, what do you call this, the object, you know. Now, it can be adjusted by a movable lever. It is usually located at the bottom part of your, what do you call this, bottom part of your mechanical stage. So let's take a look at that one. Yeah, here you go, your iris diaphragm. Yeah, wala dyan condenser, guys. I don't know why. Basta, nana siya condenser dapat. Anyway, now, I want you to take note, guys, that the illumination system, okay, as what I've said earlier, is provided by a light source in the base of your microscope. Now, what I want you to take note is that the light source is equipped with your rheostat. Mom, what is your rheostat? So, your rheostat is there to regulate the intensity of, oh my gosh, guys, of let's just move that one, of the light. Okay, this is why I hate board notes. Guys, I hope you understand. So rheostat talks about, or it is to regulate the intensity of your light. Okay, now, um uh to repeat, repeat ko, the light source is equipped with a rheostat to regulate the intensity of your light. Now, let's have your coarse and then your fine adjustment knobs. So the distance between, yes, sorry about that. So the distance between the slide and the objective is controlled by, of course, your coarse and your fine adjustment knobs. Now, please take note that initial focusing is performed using your coarse knob, okay? That moves the mechanical stage up and down, as what I have said earlier. So, initial focusing, coarse adjustment knob. And then this is usually followed by using your fine adjustment knob to, sharpen the image. So initial focusing, coarse to sharpen the image. We have your fine adjustment knob. Okay. And then we have your coarse adjustment knob. It is used to focus with the LPO objective only. So dapat LPO lang dyan siya, guys. Okay? do not use it when using HPO or your oil immersion objective. Now, for your fine adjustment objective, it gives a sharper image after the object is brought into view. And take note, both. Um, it is used only with both your HPO and your oil immersion objectives. So HPO and OIO, oil immersion objective. Coarse adjustment is for your LPO. Now, I hope that is clear, guys. Now let's check. Let's check. Now what do you call this? Let's have our next part of your microscope. We have your brightness adjustment. So it is located within the base. So for basically, this is just for adjustment of the illumination for your brightness. Now remember, guys, I want you to take note. There is a term here. It is known as your working distance. So it talks about the distance between your objective and the slide. Okay, so the higher the magnification of the object, of course, the shorter the working distance will be. And then your coarse adjustment should not be used when using higher magnifications because this will crush or wait, let's take a look at this next picture. So we have your working distance. So for example, this will be your LPO. This one is your HPO or your OIO. As you can see, the working distance for your LPO is a little bit, farther away, while your HPO or maybe your OIO, oh, oh my gosh, what is happening? Sorry guys. Uh, O, I, O. Okay, so it's a little bit um it's a little bit shorter. Okay, so that's why when we use your coarse adjustment knobs, as what the name implies, coarse, yeah, so medyo when you turn it manggot murag dali ra siya kayo mo. Charot. Sound effects. Dali ra siyang mo up and down. Whereas your high adjustment, your fine adjustment knob, like gagmay lang jud kayo iyahang kuan guys. Iyahang like movement. So it is kanang fine lang yun siya. Okay? So I want you to take note guys of the difference between your working distance sa imong LPO and your HPO OIO. Okay. So I hope that's clear, and that's basically it for your parts of your microscope. Now, how about we head on to our next part of this discussion? We have your types of microscopes. So, for this discussion, we have four types. Actually, you have your bright field, we have your phase contrast, we have your dark field, and then my favorite one is your fluorescence microscope. Okay, so let's begin your bright field microscope. Okay, so please take note, memorize it, write it down, or I don't know, unsa inyong gamiton. But for your bright field microscope, it is dark against a light background. So your organisms or what you are seeing, your specimen, is dark against a light background. So what I usually do to memorize is that bright field. So bright siya guys. So yeah, so light. So hayag inana like hayag siya, bright, hayag, synonym, charot. I hope that helps. Anyway, mo na siya. Um, and then when I got kanang if naana ko ana na thinking like light siya, like light yung background. So of course opposite ang specimen. So ang specimen kay dark. Yeah, laban lang guys. Kamo unsa inyong gamiton ana. Anyway, so your bright field microscope, it is most commonly used in the clinical lab. So mo ni siyang gina-use actually for even katong mga kuan for those laboratories na dili kayo like dato, like dili kayo in a big hospital. This This is usually what we use, more standardized na siya. Okay, so technique employs the basic microscopic previously described with the light source in the visible wavelength range. So we have your bright field microscope pathways. We have your islands, and then we have your objective. So it focuses on your specimen, and then we have your light source coming from the bottom. Okay. Now next, we have your phase contrast microscope. So usually guys, okay, so as light ray pass through an object, they are slowed in comparison to the rays passing through air. Okay, so gina-compare siya, thereby decreasing the intensity of the light and producing contrast. Therefore, phase contrast. So, accomplished by adaptation of a bright field microscope with a phase contrast objective lens and a matching condenser. Okay? Now, the image has the best contrast when the background is the darkest. Okay, so medyo kwan siya, um what do you call this, uh different or like polar opposites sila ni bright field, because bright field, young field is, or young background is light, while your face contrast, the background is dark. Okay, so meaning your specimen is light, right? Anyway, so we have here your phase contrast light pathways. So we have here your phase ring, and then we have your deflected light. Okay, so we have your objective. So what we use kanang sa paglantaw. And then we have your specimen here being viewed, and then we have your condenser, your annual ring, and then from your light source. So we have your two phase rings. Okay, so your phase contrast microscope. I'm very sorry if you can hear the dogs, guys, barking right now. This is actually one of the reasons why wala na ko na post kay during my initial video recording ani kay langas kayo ang mga dogs, guys. And yeah, murag gikapoy na akong edit. So, yeah. Anyway, I hope it doesn't um like it doesn't, what do you call this? Hala, nalibog na ko. Wait. I hope this doesn't impairs your learning. Chuck impairs. Anyway, back to the topic. We have your phase contrast light pathway. So for your phase microscope, it usually uses two rings. We have your two phase rings. We have your phase ring, and then we also have your annual ring. So it is located in the objective, and then we also have one in your condenser. Okay, now next we have your dark field microscope. So basically, mo dyan ni siya ang pinaka polar opposite yun ni bright field microscope. Kato si face, oh my gosh, na dyan ang iro, guys. Wait. Yes, okay, the dogs, uh, manana. Manana sila sa ilahang pag-aura. Anyway, so where did I stop? Okay, so your dark field microscope, guys, it's basically the major polar opposite of your bright field microscope. So, the technique used in the clinical laboratory to enhance visualization of specimens that cannot be seen easily with your bright field microscope. Okay, now it is used to identify the spirochete. This is your Treponema pallidum. Guys, are you familiar with this bacteria? Treponema pallidum. No, ma'am. Charot. Yes, ma'am. Oh, very. So your Treponema pallidum, guys, it is your what they call this? It is the causative agent behind your very well known actually STD or your STI now. It is your syphilis. The one who usually the patients having syphilis exhibits chancres in their what they call this, genital areas. Anyway, so condenser contains an opaque disk which blocks the light from directly entering the objective. And this is the result would be that the field of view is black. So again, the specimen appears light against a dark background, dark field. Okay, now we have here. So for this one, guys, actually, as what you can see here, the condenser, it actually blocks the light instead of, the light passing through. Okay? So the condenser blocks the light. So we have here your under the dark field microscope. We have your Treponema pallidum. So again, the causative agent of your syphilis. So yeah, your syphilis is it is a very well-known sexually transmitted infection disease, STI, STD. Okay, so that's it for your dark field microscope. Now, next we have your fluorescence microscope. This is so nice, guys. So it is used to detect bacteria and viruses within the cells and tissues through a technique called your immunofluorescence. So, the fluorescence is the property by which some atoms absorb light. Okay, so it is believed that, or it is usually, yeah, muna ang gina-follow that, light can be seen through a particular wavelength. And, you know, what they call this, and it also emits light of a longer wavelength. Now specimens are stained with fluorochrome or your fluorophore. These are your fluorescent dyes. Now fluorescent substance can be observed as a bright object. Take note, bright object against a dark background for your fluorescence microscope with high contrast when ultra or UV light source is used. Take note that light source are usually mercury or xenon lamps. So this is actually one of the kanang medyo unique kay the previous microscopes, more or less the same light source, but for your fluorescence, they use mercury or xenon lamps. Okay? So we have here that's basically the mechanism of your what do you call this, of your fluorescence microscope. Now take note, guys, ha, particular wavelength, okay, and it also emits light of a longer wavelength. Now we have here some examples using your fluorescence microscope. Now, this is your mitosis in rat kangaroo epithelial kidneys. So I think you are familiar with this, what do you call this? Uh, Terms. We have your interphase, prophase, metaphase, katong they like nana sila sa tunga. And then your anaphase, katong medyo bulag na sila. And then telophase is katong like super bulag na jud sila. And then your cytokinesis is like katong magcut or like they separate, which results into two new identical cells, if I remember that correctly. Okay, now, we have here your advanced light microscopic techniques. So we have your single cell organism observed with, as you can see, we have your bright field microscope. So as it has a what do you call this, light background, while your dark field has a dark background. Also for your phase contrast and your fluorescence. So si bright field lang yun ang nakalahi. Okay, now I hope that is clear for your four types of microscopes. Again, we have your bright field, we have your phase contrast, we have your dark field, supposedly or mainly used for your identification of your T pallidum, and then your fluorescence microscope, for your cells. And then we have next part is your things to remember. So basically, just additional lab safety tips for handling and caring for your microscope. So we have your wash hands and wear PPE, of course. We already established this during our first, what they call this, our first lessons. Okay, and then we have to clean your microscope. Check the wirings, okay, before plugging. What unsa ganito atong gina-use gani katong what is recommended is your three prong plugs, right? Now, we have here your next one is to check your coarse adjustment knob. You have to raise the condenser and then turn the revolving nose piece to LPO. Okay, always start with LPO, guys, because as what we have established earlier, it is used for initial determination, while ang inyong fine adjustment is for sharpening the image. Now, whew, on the light, open the iris diaphragm until maximum light comes up. So, katong knob sa ilalom sa stage. Look into the oculars and slowly turn the coarse adjustment knob until the object on the slide comes into view. Now turn the fine adjustment knob to sharpen the image. Adjust distance between oculars so one image is seen. So atong gina-use ana kay katong unsay term gani ato guys? Unsa to? Yes, your interpupillary control. Okay. Now close the right eye, look into the left ocular with the left eye, and use the knurled color on the left to bring the object into sharp focus. Use the stage knobs to move the slide left or right, backward and upward, and then you have to rotate the HPO. Look through the oculars and turn the fine adjustment knob until the object is in focus. So when you use the fine adjustment knob and the image is already sharpened, do not anymore use your coarse adjustment knob because the slide will break or the lens will break. Any of the two will happen. Now, some microscopes, guys, in like big companies or in big hospitals, they actually incorporate like a lock system. Um, they have like a lock system. Like for example, when the image is already sharpened, the working distance is kanang smaller na or like it has a small working distance, the microscope locks itself so that the user or the med tech or anyone cannot use the course adjustment anymore. So yeah, mo automatic siya og lock. So anyway, we have here rotate the oil immersion objective to the slide slightly. Place one drop of oil on the portion of the slide directly over the condenser. So look through the oculars and slowly turn the fine adjustment knob until the image is clear. Now we have your scan the slide, rotate the LPO into position. Remove the slide, okay, from the stage and gently clean the oil from the slide with lens. Paper, okay, lens paper, guys, not tissue. Moistened with your lens cleaner, not water. So we have like a designated paper and water for your lens. And then turn off the microscope light, unplug, clean the oculars, LPO, everything with your lens cleaner. So let's take a look at the basic care of your microscope. So, when not in use for an extended period of time, the microscope should always be covered or protected from dust. So, that's why in our stockroom, if you have noticed during face-to-face classes, I think, joke, first year pa din mo guys. Basta, Ate Malu, or, um, yeah, people from the stockroom, they usually cover your microscopes with like a dust cover to help prevent, dust from coming in. And then we have your microscope lenses should be cleaned with lens paper before and after each use. Before and after, guys, okay? And then lens cleaner may be used to remove oil from objectives. Avoid placing fingers on the lens surface. Fingerprints affect the contrast and resolution of the image. Okay, so basin niya, makaingon mo na hala, very important di ay niya inyuhar ditong fingerprint na unsa na nahimong what do you call this nag-doubt na noon mo kung unsay nawong jud sa imuhang what they call this, imong specimen. Now we have here, as what I've told you, do not use water to clean the lenses. We have like a designated lens cleaner for that. When transporting the microscope, yeah, I already told you this. Place one hand under the base and one hand firmly at the arm or the neck. So, guys, take note tissue should not be used because it can scratch, okay? It can actually scratch the lenses of the microscope. Okay, now next we have here your microscope storage. So if the microscope is not being used, it should be left with the scanner objective in position and the stage in the lowest position. So storage sa microscope dapat scanner power objective, and the stage lowest position. So this is for when the microscope is not used. So the stage should be centered so that it does not project or protrude from either side. Should always be covered with a plastic dust cover and placed in a ventilated, dry, and clean place. Okay, so that's basically it for our microscope. We talked about so again we talked about the history of the microscope, the parts of the microscope, care for the microscope, different types, and your microscope storage. Now, next part we are going to tackle your evaluation of your smears. So we have here your microscopic examination, your LPO 10x, your HPO 40x, and your OIO 100x. Okay? So next, the smear should have three zones. Okay, basically when you reach second year, you are going to practice smearing the blood, that you've taken from the patient so that ma-view or malantaw ninyo if naay abnormalities within his or her specimen. So we have here basically the smear should have three zones. We have your body, your head, body, and tail. So take note, neutrophils and monocytes, your WBCs, predominate in the tail area. So red blood cells lie singly, so binagsa, okay? Lymphocytes predominate in the body area, and then red blood cells overlap to some extent. So sometimes, um, basically, the normal configuration of your red blood cells is that they either lie singly or they sometimes overlap, but kanang dilipod over na overlap. Just at a unacceptable degree. Okay? Now, mo ni siya ang inyong smear, guys. This is the very popular smear. Peripheral blood smear. Yes. Okay. So, yeah, this is really hard to do, guys. Basically, when I was still a second year, third year, fourth year student, I was actually having a hard time perfecting the smear because it's really hard. I don't know. I tried many techniques, guys, pero yeah, I guess you can't have everything. Charot, 'di ba? May pagganon. Anyway, so basically, guys, for your smears, we have your head, your body, and then we have your zone of morphology. So this is really important, guys. This is where you are going to examine what do you call this? Your specimen. And then lastly, we have your tail. So, what do you call this, laboratories or hospitals, they usually incorporate two types of um I no 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 they usually incorporate either your feathered, your thumb shape, okay, thumb. They either choose between having a thumb shape smear or a block type of smear. So we have your thumb or your block. So for for as what as per my experience, Chonghua uses the block type, while Perpetual Sukor, they use this one, the thumb shape. So yeah, it's basically the same. This is where you are going to put your drop of blood. You are going to smear it with another slide, and you either get a thumb shape or a block shape. It depends, but the body or the parts are still there. Okay, next we have your microscopic examination. So microscopically well stained or perfect blood smears, peripheral blood smears. Your RBCs are color orange to salmon pink, while your WBC or your basically your neutrophils kay predominant man jud ang neutrophils sa ato ang body. The nuclei is purple to blue, while sa imuhang neutrophils, the cytoplasm is pink to tan, while the granules inside the nuclei is lilac to violet. So we're going to take a look at that later on. So we also have your WBC eosinophil. So granules are orange, while your basophil, okay, so uh, dili ni siya usually makita, or it's not usually common, but its granules can range from dark blue to black. So yeah, I do hope carry rani. I think medyo information overload, pero guys, please stay with me. So yeah, this when you view your peripheral blood smear under the microscope, this is what you usually see. Okay, this is in your feathered or feathered, what they call this, zone of morphology. Now take note, this is your platelet. This is your neutrophil. This is your red blood cells. As you can see, they lie singly or they overlap at some degree. So dili kayo like over jud na overlap. So this one, this is your lymphocyte. This is another neutrophil. This is your eosinophil. As you can see, as what it is described here, granules are color orange, diba? Color orange. And then this is your basophil. So basophil, its granules, color dark blue to black. Diba? Medyo lahi lang jud siya. This one is your small lymphocyte. Kani imuhang large lymphocyte. So, neutrophil, platelet, RBC, eosinophil, basophil, lymph. Okay. So, nanamoy gamayng visualization or like may imagine na ninyo under the microscope. Okay. Next, we have your examination using your LPO or your low power objective 10x. So overall smear quality, color, and distribution of cells can be assessed. Yes, sorry for that one. Now, feather edge and lateral edges can be checked for WBC distribution. RBC distribution can be assessed, the different types of clumps lying singly in an. And then we have here, you have to check for the presence of platelet clumps. Take note, guys, the area available for suitable examination can be assessed. It is called your monolayer area or your zone of morphology. You can also term or you can also call it as your critical area of reading. So either of the two, guys. zone of morphology, critical area of reading, or you can also answer monolayer area. Basta, it is the site, okay? It is the area where suitable examination can be viewed or assessed. Okay. Wait, guys. So take note, guys, that you have to adjust your light and condenser. And the iris diaphragm for this one, guys, should be open to allow comfortable amount of light. So you have to adjust your light you have to adjust your light source, your condenser, and then your iris diaphragm. Okay, so this is what you will usually see using the LPO. Okay, so yeah, so you can see big yun ang imuhang WBCs. Okay. Now we have here where like how to know if you are in the correct field, like if you are in the monolayers. Okay, sorry guys. So question is where or how to know if you are in the monolayer area or your critical area of reading. So what you see in the microscope is this one, guys. So for your feathered edge, it is usually at the tip. So daghan na, bulag-bulag na siya, guys. Daghan ng like so much spaces. So many spaces, so little cells can be seen. Whereas your body area, okay, this one, okay, all of the cells are clumping together, so many cells, so little space. Whereas in your monolayer area, as you can see, um, the cells can be seen like singly, guys, like an equal distribution of your space and your cells. There is like overlapping, but it is like in an acceptable degree, unlike your body where like in one field you can see like many overlapping. Okay, so I hope that's clear. Your monolayer area, it is where you should assess or like it is the site where you should see your cells. Okay, now next we have here yeah kanang unsa na this is just like kanang what do you call this drawing version. While this is the actual thing. So this one is in your body area. So as you can see, all the cells are clumped together, whereas this one is the optimal, your monolayer area. And then for your feathered edge, guys, yeah, as you can see, daghan kaayong spaces. Daghan kayong spaces. Kani kay daghan kayong clumps. Kani kay perfect. Perfect. Okay. So I hope that's clear, guys. Now, let's delve in deeper with your zone of morphology. Okay. Okay. So for your zone of morphology, it is called as your critical area of reading or your optimal assessment area. It can be found in the monolayer area. And as you can see, the RBCs, what you have to take note for this one, guys, ang una dyan yung lantawon is your RBCs, okay? Okay, so what you have to take note are your RBCs. Now they are uniformly and singly distributed, okay? As I think you have already seen the pictures. And then with few touching or overlapping and have their normal biconcave appearance. Now take note, guys, we usually read these cells or your RBCs and WBCs, we usually view them through your oil immersion objective. So for this one, we have your one oil immersion field or OIF. It generally contains 200 to 250 red blood cells. So inana kadaghan guys ang inyong makita. Okay. Now we have your mature red blood cells. So to make your red blood cells, guys, it is through the process of erythro erythropoiesis. Okay, so I'm not going to delve in deeper with these terms, guys. Information overload, and you are going to tackle this one in your third year subjects, in hematology. But just a quick side note, guys. Erythropoiesis, um, it is usually regulated by your erythropoiesis erythropoietin. So the higher your blah, blah, blah. The higher your erythropoietin, daghan pud ang iyang himuon na RBCs. Okay? Merg smiley face. Anyway, it is usually 6 to 8 micrometers in diameter. The color is pink to slightly reddish cytoplasm, so it has a clearer center. Okay, your central pallor is usually 1/3 of the diameter, so that's why um, mo na siya ang usual niya na configuration or drawing. Wow, very nice circle. So basically, inana siya, guys. Like this is your red area or pink, and then this one is clear or whiter appearance, your central pallor. So it is non-nucleated biconcave. It has no granules, munang very smooth ang iyang cytoplasm, and take note, guys, up to 16 red blood cells are produced from a single rubriblast. Okay, so this is like a prerequisite in making your RBC. So again, I'm not going to delve in deeper because it is really what they call this. It is really hard to explain in simple terms. Samot na if wala pa jud mo nakakita jud or like naka heads up maybe ani na terms. But basically, guys, all you have to know is that up to 16 red blood cells are produced from your rubriblast. Now rubriblast, it is like uh butang na tawag, your RBC is like um level 2. Just an example, guys. So your RBC is your level 2. So inyong Ruby Blast is your level 1. Okay, so before na siya, like baby version. I hope that helps. Anyway, so please take note, guys. Please remember that the lifespan of your RBCs is only for 120 days. After 120 days, they die. Actually, they die, and then they usually have or they are usually what do you call this destroyed or reincarnated in your spleen. Okay, dira sila ilubong sa inyong spleen. Okay, so as what you can see, this is your RBC, central pallor, pink to slightly reddish cytoplasm. Now next, we have your band neutrophils. So this one, guys, it is your level 1 of your neutrophil because your segmented neutrophil, we are going to talk about that later. Your segmented level neutrophil is your level 2 while your band neutrophil is level 1. So this is like the immature version of your neutrophil. Okay? And then take note, guys, it is the youngest cell, it is the youngest, like, level 1 cell in the series, in the like blood cell series to appear normally in your peripheral blood. So please take note, it is also called as your stab or your staph cell. It is 9 to 15 micrometers. It is elongated or band shaped, curved or sausage shaped. And guys, take note, it has fine granules. So, si RBC ninyo, no granules. Si band neutrophil has fine granules. So, as you can see, it's like a telephone or a sausage. Yeah, this is your band neutrophil. Okay? Now, next, we have your level 2, the final boss. Charot. Level 2 is your segmented neutrophil or your mature neutrophil. So, it basically has pink to rose violet specific granules, and it usually has 2 to 5 lobes. So, greater than 6, guys, it is called your hypersegmented neutrophil, and it is associated with different diseases po. So normal ones, usual na to makita are just 2 to 5 lobes. Okay, so this one, here you go. So you can see 2 to 5 lobes. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Okay, 2 to 5 lobes. Normal, segmented, level 2, mature neutrophil. Level 1 is your band neutrophil. Okay, next we have your eosinophil. So take note, guys, the difference between this one is that its granules are very specific, or it's very um, it can be seen easily. Like, did you naman siya ma-mistake, guys, for anything? Charot. What I want you to take note is that it has 2 lobes. It's the same as your band neutrophils, but as you can see, okay, what do you call this? The granules are usually much more predominant, or like it's easier to see compared to your band neutrophil. 'Di ba? Like, even though naa siya yung mga granules here and there, but it's not really, what do you call this? It's not really dominant, you know? 'Di ba? 'Di ba? Okay, so I hope that's clear. And the next WBC we're going to take note is your basophil. Now, the basophil here, okay, it's not normal for you to see greater than 5. Yeah, I think that's greater than 5. It's not normal to see like 5 basophils in one field, because that actually connotates to like a health problem. Now, its granules are usually dark purple to blue black granules, and it is generally unsegmented or bilobe, so 2 lobes Japon, guys, and it rarely has 3 or 4 lobes. Now, 'di ba? So you can see, this is your neutrophil, this is your RBC, this is your segmented neutrophil, 'di ba? Na siya granules, but it's not really dominant compared to your basophil. Okay, it's really dark blue black granules. It's not the same with your eosinophils, because your eosinophils, its color was a little bit like orangey compared to your basophil, and then its nucleus is like a telephone configuration or headphone configuration. Okay, so now next we have your small lymphocytes, your lymph. So lymphocytes, they usually when there is like an increase of lymphocytes, it usually connotates to like a viral disease. Okay, so there are 2 types. We have your small lymph and then your large big lymphocytes. So small lymphs are usually round, diffuse, lumpy to compact chromatin structure. Okay, so we have your a picture. Okay, so as you can see here, for your small lymphocytes, um, what they call this, the cytoplasm is usually just small. Yeah, it's smaller compared to your large lymph. Mas dako ni siya, gamay ang cytoplasm. Okay? Yeah, inani jud ni siya, guys. Inani jud usually nyo makitaan na small lymph. Whereas your large lymphocyte, it is its cytoplasm. It's usually colorless. It has a larger large cytoplasm, 'di ba? Yes, 'di ba? Inana. It's much more larger. So, guys, take note, lymphocytes, it usually has two types. It usually produces two types of cells. We have your B cells and then your T cells. And then your T cells, they are produced in your thymus. That's why, just to, para mawala ang libog, TT, charot. TT, charot. Anyway, while your B cells, they are from your bone marrow. Okay, bone marrow. And then, yeah, your T cells, they are produced using your, let me just change that. Your thymus, your T cells, they are usually produced using your adaptive immunity. Guys, dili erjo ko mo delve in deeper kay malibog na niya mo, but this is just like an overview. Adaptive immunity, while inyuhang B cells, the humoral immunity. Okay? Immune. Wow, naunsa na ni. So, humoral immunity. Okay. Now, T cells from your thymus, it produce cytotoxic cells, it is the result of your adaptive immunity. Whereas your B cells is from your bone marrow, they usually produce your antibodies and your memory cells, and this is the result from your humoral immunity. Okay, so B cells, it can either produce your antibodies or your memory cells. So, I hope wala pa mo nalibo, guys. Okay. Next, we have your monocyte. Now, your monocyte, guys, it is the largest cell in the peripheral blood. Take note, largest cell. It has a blue-gray cytoplasm, and it has many fine azurophilic granules. Okay, so as you can see here, we have your monocyte. And then this is your red blood cell, and this is your platelets. Now, speaking or talking about your platelets, they are known as your thrombocytes. If you have watched Cells at Work, katong mga kiddos dito, they are your thrombocytes or your platelets. And then this is from your cytoplasm fragment of your megakaryocytes. Okay, so Monisha, usually this is like a small lymphocyte, and these are your platelets. Okay, now just a quick turnout of that one. So we have your smear of a peripheral blood. So we have your platelets, we have your erythrocyte, your basophil, your monocyte, and then we have your lymphocyte, diba? We have two types, your small and then your large lymphocytes. We have your segmented neutrophils, your level 2 segmented neutrophils, your mature, and then we have your eosinophils with your orangey granules. Okay, another picture. Here you go. Para ma-incorporate yun ninyo, guys. RBC, platelets, neutrophils, segmented ones actually, neutrophils, and then we have your monocyte. Usually medtechs confuse monocyte and lymphocyte, but usually ang inyo dong lantawon monocytes, they have like kaning whitish part here, kanang they have like lobes, vacuolations for your monocytes. Okay? Okay, unsa ni siya, guys? Pop quiz. Yes, your erythrocytes or your RBCs. How about this one? What is this? Yes, okay, very good. Your segmented neutrophils. How about this one? Of course, your thrombocytes or your platelets. Kani, who is this? I joke. So ni. Who is this one? Your very good. Your band neutrophils. This one, your RBCs again. Okay, kinsa ni? Who am I? Yes, okay. Your small lymphocytes. Kani? Of course, si large lymph ma'am. Kanin yung RBCs, di ba? Lain-lain na dyan po siya gnaong. But basically, they same na dyan. Kani, who is this with your orangey granules? Of course, we have your eosinophils. Yes, your eosinophils. Okay, this one? Yes, your basophil. Okay, very good. Now, guys, let's tackle this term here, your what do you call this? Your abnormalities of your cells. So the term used, it is usually what do you call this? It is usually called your poikilocytes. Now, poikilocytes refers to your variation in shapes. Okay, that is the actual meaning of that one. And then, whenever you encounter poikilocytes, guys, they usually connotate a disease or under an underlying problem. Okay, now let's take a look at different poikilocytes. First up, we have your acanthocytes. So this is usually known as your spur or your thorn cells. Kani siya, guys, kani. This one. So this is what they call this. They usually we usually describe them as a spheroid with 3 to 12 irregular spikes. So we usually see them in increased cholesterol and in a disease called your A beta lipoproteinemia, 'di ba? Super taas. Pero good to know rin ni siya, guys. Good to know. Just a quick side note dyan ni siya. Acanthocytes can be seen with your A beta lipoproteinemia. Okay. Yes, Monisha. Next, we have your echinocytes. So, echinocytes known as your Burr cells or your crenated RBCs. So, Monisha. Okay. So, they are usually 10 to 30 projections and are evenly distributed unlike your acanthocytes na gamay lang ang iyang projections. Okay, 'di ba? Kana. Now, next, we have your elliptocytes. As from the name suggests, elliptocyte. So these are your rod or cigar shaped, and they are now narrower than ovalocytes. So from the name itself, ovalocytes, so they are like oval, more oval in shape. And defect considered to be in the cytoskeleton. Now let's take a look at more pictures of your elliptocytes. Here you go. Now, next we have your schistocyte. Yeah, schistocyte. So these are your fragments of RBCs. They usually vary in size and in shape. Take note, guys. Usually we usually incorporate schistocytes with trauma, like how you smear, the way you smear or your specimen. So muna siyang usual na kwan. It is associated with trauma. Okay, so diba fragments of your RBCs. Next, we have your Depranocytes. So your Depranocytes, they are your sickle cells. Okay, and um, basically, guys, your Depranocytes, it is the presence of your hemoglobin S. Now, just a quick side note, guys, there are a lot of hemoglobin, what they call this, names in when you learn hematology. Now, in the absence of oxygen, hemoglobin S polymerizes into rods, causing the shape to sickle. Okay, so yeah, Manisha, here you go. So basically, guys, the pranocytes, abnormal hemoglobin content. That's all you have to know. Okay. we also have your keratocytes. So your keratocytes, more sila gikanan, as you can see, like chomp. So yeah, that's why they are called bite or your helmet cells. Kay nadiri mong ulo. Yes, naman. Always wear your helmet when you are in Dumaguete, charot, or drive safely. So keratocytes, bite or helmet cells. Guys, unfortunately, I don't have or I can't recall any mnemonics for you. Kay personally, naglisod po ko. Naglisod po ko memorize ani sa una, guys. I don't know how I did. I can't remember how I survived third year. Pero basically, guys, yeah, there are a lot of poikilocytes and you are going to remember and know them when you reach third year. Yay! So it's good to know na as early as now you have like a slight or like you have kanang na-touch na ninyo ni siya na topic. Okay? Now next, we have your smudge cells. So they are nuclear remnants of your lymphoid cells. So it resembles like a thumbprint appearance. So more siya kanang bitong thumbprint and then a smudge. like wala siya naayo. So that's why it is called your smudge cells. So one thing you have to take note in your smudge cells is that one reason could be it's not like an abnormality. It's in how you make your smears. So maybe your pressure in making smears is too great. That's why your cells, you actually like ripped or smudged them off, resulting to smudge cells. Now, next, we also have your basket cells. Now, this is the last one, your basket cells. They are usually degenerated nucleus, and the same as your smudge cells, it can also be the result in the pressure in the making of your smears. Okay, now I think that's it. Yeah, that's basically it for this discussion, guys. Um, I hope you learned something. Just a quick review. We talked about the history of the microscope, the parts of the microscope, the different types, the care and handling and storage of a microscope. We also discussed, your peripheral blood smear under your LPO, HPO, and your OIO. We also tackled, just a quick side note of your different blood cells and your abnormal blood cells. So, if you have any questions, clarifications, violent reactions, guys, I hope you don't have violent reactions. Please do send me a message in the group chat, or you can, send me a private message in Facebook Messenger. Yeah, that's it for this lesson, guys. I hope you learned something new. As always, okay, stay safe, stay healthy, always drink your water, and I'll see you in our next discussion, guys. Bye bye.